Well, osteoarthritis affects all the major joints of the body, or can do, and the actual cause of the most common source of osteoarthritis is actually not fully known. But the most widely accepted cause is that over time, the cartilage becomes, for want of a better word, slightly more soggy and friable, much like dipping a piece of tissue paper into water. And that leaves it exposed to physical damage. And much like water that gets into the cracks of your pavement or patio, then as the fluid from the joint gets in, it can expand and start to damage the joint, and over time the cartilage starts to disappear until eventually the bone ends are rubbing against each other, which is obviously extremely painful and gives you that classic gnawing toothache pain associated with arthritis. So there are lots of risk factors associated with wear and tear or osteoarthritis. Probably the commonest one is just bad luck or genetics. People, for reasons that we just don't know, seem to develop osteoarthritis. There are some more obviously well-known ones. Being overweight, for example, can lead to an increased force across your joints. Having an injury when you're a younger person leading to an abnormally shaped joint after trauma can also predispose you to getting osteoarthritis. Or having an inflammatory arthritis such as rheumatoid or psoriatic arthritis can weaken or damage the joint and allow wear and tear osteoarthritis to come along as a secondary feature. Well, there are certain things that are within your control and certain things that are not. You can't change your age, you can't change your gender, and you can't change your genetics. But what you can change is your lifestyle and your strength of muscle around the knee and your weight. And we know that the less force you put through your knee, the less symptoms you will get from any arthritis that you have got. And there is some evidence to say that a healthy weight can minimize the amount of osteoarthritis that you develop. In terms of controlling symptoms, having strong muscles both in the front and the back of the knee help control the fine movements of the knee and can improve overall the symptoms that patients describe. Particularly helpful, I found with my patients, is either a static or a pedal bike, which really works on those quadriceps and hamstring muscles to control the knee movement. Well, it's a combination of a clinical medical history that I would take from someone coming to see me. Patients will classically tell me that they develop over time a deep-seated gnawing toothache type pain in the joint, sometimes with good days, sometimes with bad days. Patients may describe that the knee gives way or they don't trust their knee anymore, and that it makes them feel miserable. In terms of clinical examination, there'll be pain around the joint line, both on the inside and the outside of the knee often. The movement of the knee may be somewhat restricted. It may not bend or straighten as much as it used to do. And there may be some swelling from within the knee. The other thing to look at after that is the X-ray changes. And there are some X-ray changes that we would look at to appropriately diagnose osteoarthritis. But overall, it's a combination of all of those things together. So surgery is a discussion. It comes from a discussion between myself as the surgeon and the patient who has come to see me. Sometimes the decision is quite straightforward. Pain has been going on for a long time. Quality of life has reduced significantly, and the X-ray and the clinical features of the examination point all towards what we would call end-stage osteoarthritis of the knee. In which case I would recommend a joint replacement. Now, that is not always the case, and sometimes these situations are more subtle. And that's from my experience. I take the patient through what is available to them, and what we're trying to do is pick the patient off absolutely at the right time, where their symptoms are bad enough, where they are going to stand to benefit the most from surgery, and they haven't left it too long, that the joint is significantly damaged and their recovery would be hampered because of that.